Greetings, families. Welcome back once again. I hope you are well. I hope your day is good. Thank you so much for clicking on this video. This video is from Burkina Faso. The first video you're about to watch, you heard about it. It's about the kidney transplant that happened in Burkina Faso. I've shared the part that the Turkish doctors came to thank the president, Captain Ibrahim Traore, for allowing them to do that operation successfully. Yes, and I said if there's any update, I'll be here to share it. I have it for this now, and I want to add it to this video. The doctors themselves took us to the hospital to tell us what happened. Families, please listen, and I'll be back.
Of Burkina Faso, kidney transplantation is now possible. The achievement was made at the Tengandogo University Hospital, where specialists in the field successfully performed the very first kidney transplant in Burkina Faso. Behind this achievement lies an ambitious health policy, driven from the highest levels of the state, a policy that enabled the training of personnel in kidney transplantation in the Republic of Turkey. Mumuni Wanga attended this first procedure, which was a complete success.
The patient you see here no longer needs dialysis. She has just successfully undergone a kidney transplant, the first ever in Burkina Faso, and it took place at the Tengandogo University Hospital Center. But to get to this point, several months of preparation were necessary.
Of course, she was admitted to the hospital 3 days ago for preparation. And her generous donor was also admitted for comprehensive preparation for the significant medical procedure we successfully performed this very morning.
And it is an immense joy for a nephrologist to see a patient who has been able to receive a kidney transplant, and as a result, it eliminates the need for dialysis.
The staff at the Tengandogo University Hospital has benefited from the support of Turkish technicians.
The kidney we transplanted is fully functional. There are no problems at all. Everything went very well, because the preparations were also very good.
It is an immense joy for us to have contributed to improving the quality of care in Burkina Faso by, of course, providing this kidney transplant to this patient.
The collaboration is based on an agreement between the Ministry of Health and the Turkish Foundation for Organ Donation and Kidney Transplantation.
The state has made an exceptional sacrifice. We had already given a little more. But the state postponed a budgetary adjustment with the authorization of the head of state to make available to the Tengango Hospital 2 billion CFA francs. And out of those 2 billion CFA francs, we signed with the Turkish Foundation for an amount of 1.4 million euros, which is about 600 to 700 million CFA francs, to ensure the training and skills development of our teams in Turkey.
This operation is carried out as part of the National Transplantation Program of Burkina Faso. The first, as well as the next 9, are covered by the Burkinabe state. So behind this achievement lies a government health policy. Under the leadership of the head of state, Captain Ibrahim Traore, the head of state.
Thank you so much for listening and watching. I had it at the time that the app was disturbing me, so I put it somewhere. Now I work on it. I want to add it to this video. The reason being that the one you are about to watch is one of the villages that they now have a brand new community hospital, maternity, and also lab as well attached to it, and one special equipment. I don't know how to explain it, but you will see it. Families, please listen and watch. I'll be back. Thank you for your time.
Or to renovate 19 health centers, all for a total cost of 300 million CFA francs. We are attending the key handover ceremony with Kasum Milogo and Sayubama Mbune.
The governor of the Tanuya region, Badabe Florent Bazier, is here receiving keys from the hands of the director of the Plurial Project. Keys to several healthcare facilities, including among others maternity wards, laboratories and latrines. These facilities were built and or renovated in order to qualitatively improve the healthcare services available in the region.
The situation was, as we say, not satisfactory when we conducted what is called an assessment and observed the deterioration of the facilities. So In collaboration with the health officials, we decided together to provide our support in order to rehabilitate these health centers. And you know that the Minister of Health's guiding principle is to improve the quality of care for the population, wherever they may be. These facilities will allow healthcare workers to operate under optimal conditions. This comprehensive system consists of a robust set of essential infrastructures and specialized equipment, all meticulously provided by this dedicated partner. This significant contribution will undoubtedly and greatly contribute to providing much better and more effective care for our entire population, ensuring their well-being and health. And this truly deserves to be commended.
To ensure better hygiene and to prevent and control possible infections, the project draws on local expertise by equipping the Banfora Regional Hospital Center with a model incinerator called Wabzanga, which means grinds everything in the Moray language.
This will allow us to incinerate our waste to keep our workplace even cleaner, and it will undoubtedly improve the quality of care. We have had a laboratory that was renovated at the Sengu Medical Center, CMA. This will increase and improve the operational capacity of the Sengu laboratory. There will be other activities we can now carry out, such as blood transfusions, which we were not able to do before. More than 970,000 people will be able to benefit from these materials and facilities that have been provided.
Health is now at the heart of action in the state of Molens. These 19 health centers are a symbol of a lasting commitment to the well-being of the population. The Plural Project is being implemented by a consortium of 3 Canadian organizations. In addition to Burkina Faso, the project is also being carried out in Mali and Benin.
Thank you so much, families, for listening and watching. I still don't know what that particular equipment would do, but according to them, it will help a lot. You heard them. So yes, it is good. And if it is something the way they are saying it, and it is made in Burkina Faso, I must call upon them to do it and spread it across all the hospitals. I just remember one of the ministers is not happy about one project. I'm working on it. I'll bring it later, because you know the government promised to build hospitals in every community, so you don't have to travel far unless it's very, very serious. And that's what they are doing. I added another video to this one. Hospital cannot function without blood transfusion, without blood donation. Sorry. So yes, they are donating blood, going around campaigning for people to donate blood so the hospitals will function wherever they are, not in one community. Families, please listen, and I'll be back. Thank you for your time.
The association SOS 100 is taking a leading role in the fight to ensure the availability of the precious liquid in blood banks. A campaign to intensify and raise awareness about voluntary blood donation is currently underway across the entire national territory. The monitoring of this campaign led the leaders of the association, Hassan Gebre and Nicolas Sorgo, to the Nakambe region.
Who wouldn't be proud to know that their blood is going to save a life? This is the question posed by these posters to users of National Road number 16, which can be seen in the hundreds over nearly a kilometer within the city of Saint-Faudegout. They feature the president of Faso, Captain Ibrahim Traore, smiling broadly as he donates blood. The SOS 100 Association, in coordination with regional authorities, is here this morning to monitor the campaign to intensify awareness about voluntary blood donation, which was launched on August 8th in Ouagadougou.
This communication effort that we are undertaking, which we wanted to intensify using the image of the head of state, is meant to send an even stronger signal to reinforce the message that the head of state conveyed for the benefit of the population, to say that today, no one is immune from a possible need for blood.
This is the call I am making to the sons and daughters of the Nakambe region, urging them to come forward just as the head of state has set the example to donate their blood in order to save lives, those of children, women, and young people.
No one is immune from needing blood, and it is the president of Faso himself who is showing the way to follow through these images. In this period when malaria is rampant, donating blood can save thousands of children and women, not to mention those injured in operations.
In terms of blood transfusion needs, we estimate about 70 bags of blood per day. And these blood transfusions are carried out from the regional hospital center to the medical center with the surgical unit, so across different healthcare services.
According to the representative of the National Blood Transfusion Center, Charles Kisito Bationo, around 243,000 bags of blood will be needed for the year 2025, according to forecasts. By intensifying awareness about blood donation, SOS 100 aims to help achieve this goal. As their slogan says, a blood donation equals a life saved. The association therefore invites all Burkinabe between the ages of 18 and 60, and especially the people of Nakambe, to donate blood regularly.
Thank you so much for listening and watching. Congratulations to those who have been donating the blood, the organizers and everything. For me, blood donation is very close to my heart. I know some people don't like it or some religion is against it. I know that, but for me, that is a lifesaver in my household, because I was saying that I was busy. I was in the hospital throughout yesterday, and because of my son, as many of you know. So I'm happy they are doing what they are doing to save other people as well that needed it. They need this blood transfusion to be normal. So yes, and also we know the soldiers as well, they need this blood transfusion. A lot of people, recently I shared a video about Niger, Africa sickle cell. It's a lot in Africa. It's a lot in Africa, and now they are creating awareness more about sickle cell. These sickle cell patients need blood donation apart from the military. So what they are doing, well, congratulations to them. I'm happy that they are doing what they are doing, because our president did it, the ministers did it, and now the citizens are following up. We know everything the president asked them to do, because they trust him, they will do it. Having said that, without hygiene, this hospital will be full and full up. So yes, they have selected or elected someone to be advocate for hygiene, cleanliness in one of the communities. Families, please listen and watch. I'll be back.
In Dedougou, in the Bankwe region, we are witnessing the official launch of the WASH project, a sanitation and access to clean water initiative led by the Belgian Agency for International Cooperation. To ensure its successful implementation, a planning meeting brought together the various stakeholders of the project. Report by Naba Ida Dabiri and Akani Pauline Abikaba.
To improve hygiene and sanitation conditions and to put an end to open defecation, the Belgian Agency for International Cooperation, ENABEL, is supporting the municipality of Dedougou. Through this institutional triggering workshop, it engages with administrative and traditional leaders, as well as various segments of society involved in these areas in Dedougou. This is a way to ensure their full participation in community-led total sanitation.
Hygiene and sanitation issues are collective matters. As long as people do not come together, as long as people do not address hygiene and sanitation both individually and collectively, it will be very difficult to solve the sanitation problem.
The traditional and administrative authorities have expressed their willingness to carry out awareness-raising activities. To this end, the Canton Chief and the High Commissioner have been appointed as ambassadors for hygiene and sanitation.
I have indeed received this honorable sash, and it is certainly not just for the mere purpose of going to sleep or resting. I am asking the entire population to join hands and work together to keep the city clean.
Clean places prevent many diseases, so it has a significant impact on the overall economy, because when we are healthy and in good well-being, we can actively work for the sustained development of our nation.
The Belgian Agency for International Cooperation is implementing the Lasso Wash project in 6 municipalities in the provinces of Muhun and Balis.
Thank you so much for listening and watching. He has promised to create awareness. I mean, yes, I think of something, but let me leave it there. Create awareness of cleanliness in the communities, because without the communities being clean, this malaria, mosquitoes will never go away, because they love that. So yes, they will be breeding more. They have to clean everywhere, so they will not be going to the hospital as often as they should be. So yes, he will do his job, and I can't wait If he do his job better, they will give him an award as well, as they do in these three countries. If you do something good, they bring you out to tell others, to motivate others as well to follow suit. Congratulations to him. He must have done something great for him to get selected to be the leader, to be spreading this very important message across. So yes, I will leave you here. Thank you so much. Have a wonderful day. My family's credit to RTB News Faso 7 and BF1. Let me add that to it. Thank you. My VIPs, my kings and queens, my returning families. If you are new here, thank you for clicking on this video and for subscribing. I would like to know you better under the comment section as well. Thank you. And yes, I work on the videos before I'm sharing it. I can trace them back if you want to. Thank you. I'll be back with the update on the malaria issue that is going on many channels. See you soon, my families. God bless you all. Bye-bye.